Hi, my name is Dr. Ron Peek. I'm a chiropractor in Mount Laurel, New Jersey. I'm also the creator and the developer of a series of self-help videos that we use in our office. We use them to supplement the care that we provide to our patients, and we find when our patients utilize our videos, they get better faster and stay better longer. Now I'm here today to talk to you about probably the most common problem that we see in chiropractic offices, and that's chronic low back pain. Now I want to differentiate between what I'm going to call short-term low back pain and chronic low back pain. I'm not talking about short-term low back pain. That's that thing where you just overdid it yourself and you bent or you twisted or you lifted something a little too heavy and you strained or sprained some of the muscles in your low back, and it kind of hangs in there for 7 to 10 days and then it goes away. It's self-limiting. That's not what we're dealing with today. I'm talking about a chronic problem, meaning it's been there for weeks or months or usually years. It comes and goes. Sometimes it's affected by the weather. You get a bout here and there when you know you overdo it. There's certain activities you know you can't do. Chronic low back pain, what I'm talking about is what's affecting the quality of your life. All right? Now what can cause that type of low back pain? Actually, there are lots of things that can cause it. I want to talk about what I find to be and what chiropractors have found to be the most common cause of chronic low back pain, and that's misalignments to the vertebrae in your lower back. Now if we use my hands for just a second and we pretend these are some of the vertebrae or the bones in your lower back, when these vertebrae line up properly, as they should, there's a little opening on the side and the nerve can pass out very easily. Now that's the only place in your body where a nerve must pass through movable bone, not just the low back but all along the spine. But the tissue that's involved here is the vertebrae is surrounded by muscle tissue, and there's a joint with the vertebrae, the nerve which I just mentioned, and then there's a disc. And if something causes a vertebrae to shift out of position anywhere in your spine, but we're just talking about the lower back now, it can irritate any one or all of the involved tissue. In other words, a shifting of the vertebrae will affect the nerve, it will affect the muscles, it will affect the joints, it will affect the disc. And usually any one or a combination of those can cause the pain that comes and goes and creates the chronic problem that we're describing to you. You know, it's interesting to me. People can understand and accept the fact that teeth, which aren't supposed to be movable, can shift out of alignment, and we send our children to an orthodontist to get our teeth realigned because we know teeth can misalign. And yet we forget that vertebrae, the bones in the spine, which are designed to be movable, can shift out of alignment much more easily, and they do so much more frequently and create much more damage than crooked teeth. I'm not saying don't go to the orthodontist, but I just want you to understand that vertebrae can shift out of alignment much more easily than teeth can, and it's an overlooked fact sometimes. In any event, when vertebrae do shift out of alignment and when you do have chronic low back problems, oftentimes what people do is they take some painkillers to mask the pain. Remember, there's always side effect involved in those medications, but the problem here is you're simply hiding the problem, you're not correcting it. And oftentimes when people get into taking their painkillers for weeks and months and years, all that's happening is the vertebrae are degenerating and deteriorating more and more, and you're putting off the inevitable. So be aware that the proper way to deal with it is to correct those misalignments. Just as you take your crooked teeth to the orthodontist, you take your misaligned spine to the chiropractor and get those misalignments corrected properly. Chiropractors are trained to locate and correct misalignments in your spine. That's what we do. And again, if you come to the chiropractic office, we would look and see if the cause of the problem is coming from misalignments in the spine or not. Basically, if you come to our office, for example, if you mention you've seen this video, we'll do a no-charge examination and a no-charge consultation with the doctor. That's me. And we'll let you know if there's misalignments causing your problem or not. If we feel we can help you, we're going to tell you that. And if we feel that it's not a chiropractic problem, we'll tell you that also. The last point I want to make here is that chiropractic has grown and evolved just like other professions. And as we've done so, we've learned how to make corrections of the spine more easily and more comfortably than we've done before. There are new scientific instrumentations that are used in many chiropractic offices. Like in our office, we use a handheld device called the Impulse. It allows us to stimulate the joints of the spine, the muscles, and the nerves. And again, we can make corrections very comfortably on patients much more easily than many people realize. So keep that in mind when you're contemplating what to do with your low back problems or your chronic problems. So again, if you've been experiencing chronic low back pain, or if you know someone who's experienced low back pain, call our office. You can reach us at 856-778-8653. Again, mention you've seen this video. We'll give you a no-charge consultation and examination to see if we can help you. Also, you can go online at www.drpeakchiro.com, and we have a discussion forum. You can type in a question if you have a question about anything you've seen on this video, and we'll answer it as best we can and get back to you as quickly as possible. So I hope you found this informative. I hope there's something that if we can be of service to you, you give us a call or let us know in some way, and perhaps we can help you enjoy life a little bit more with less back pain. Thank you so much.